Okay, so my drug is called Palforzia, also known as peanut allergen powder. This drug is part of an allergenic class, which is often used in oral immunotherapy to reduce the risk of allergic reactions to foods. Surprisingly, in an article from late January this year, it was reported that the FDA officially approved Palforzia as the first treatment for peanut allergy, which would give it prototype status in this category of drugs. The mechanism of action for Palforzia is not entirely established, but it is generally shown to reduce the severity of allergic reactions by desensitizing the immune system to the allergen through a gradual increase in its consumption. Palforzia is used to treat people who have a peanut allergy and is intended to gradually decrease their sensitivity to small amounts of the peanut protein that may be found in foods. This drug may be started on patients between 4 and 17 years old, but the treatment should continue after age 18 unless it has been contraindicated. The drug is only administered at the same time every day as an oral powder to be mixed with soft room temperature foods such as applesauce, yogurt, and pudding. After refrigeration, the powder should be emptied from the capsules into the food consumed immediately after mixing. Although this medication comes in capsules, it is important not to swallow them instead of emptying them. Wash your hands immediately after handling this drug, if you weren't already planning to do so. Do not take more than one dose in a single day. If you miss a dose, contact your doctor. Be aware that allergic reactions are more likely to develop within approximately 1 hour of taking the dose. Palforzia does not treat allergic reactions and should not be given during an allergic reaction. The most commonly reported side effects were stomach pain, nausea and vomiting, burning of the mouth and throat, coughing, sneezing, hives, and itchy ears. Palforzia can also cause severe life-threatening allergic reactions that can include dyspnea, dysphagia, chest and throat tightness, facial swelling, syncope, rash, and flushing of the skin. Palforzia is contraindicated in clients with uncontrolled asthma, a history of eosinophilic esophagitis, and eosinophilic gastrointestinal diseases. Those who are unable to tolerate initial dosing or comply with the daily dosing requirements, or those who are unable to tolerate initial dosing or comply with the daily dosing requirements. Other conditions may increase the chance of allergic reactions, including having a viral infection, being very tired or stressed, having your menstrual period, exercising, and drinking alcohol. Pregnancy and lactation are areas yet to have been studied in clinical trials of Palforzia, though. Palforzia has over 62 major interactions, which include alcohol and pain medications such as ibuprofen and aspirin, so consulting your provider before taking a new medication is of paramount importance. This drug has also not been evaluated for its toxicology or excretion. But clients who overdose may exhibit hypersensitivity reactions such as anaphylaxis or local gastrointestinal allergic reactions and should be instructed to use epinephrine and seek immediate medical assistance. The population for the double-blind clinical trials consisted of 496 subjects between the ages of 4 and 17 years old. There were 372 subjects taking Palforzia and 124 taking a placebo. After the initial dose escalation from half a milligram to 6 milligrams on day 1 and a confirmation 3 milligram dose on day 2, subjects underwent updosing for 20 to 40 weeks, starting at 3 milligrams until the 300 milligram dose was reached. The updosing period varied for each subject depending on how the dose was tolerated. Upon completing the testing period, subjects submitted an exit survey to assess their ability to tolerate increasing amounts of peanut protein with no more than mild allergic symptoms. The results showed that 69.6% of the patients taking Palforzia met this criterion, while only 30.6% of the placebo could say the same. Oh, I did it. And that's my drug, Palforzia.